So my name is Sven Bestmann. I work at the Sobel department here at UCL at the Institute of Neurology. I'm a reader in motor neuroscience, and as that probably tells you already, most of my research is concerned about the brain and how the brain controls our movements. My big research question is actually how we move, or in other words, how does our brain control our movements? Little things like waving the hand around, making us walk to the place where we want to go, and how does the brain put our thoughts into actions? So very long-standing questions, and a question certainly in neuroscience that has been a question for more than 100 years, but even philosophers have already thought about that very deeply. And unfortunately, we still don't know how our brain turns our thoughts into actions. How is the idea to, in the morning, to go and get a coffee enabling me to actually do exactly that? And how does the brain control my movements, sends impulses to the muscles to achieve exactly that? So we're trying to understand that, and furthermore, if we had a better handle on that, it would help us to understand what goes wrong when things go wrong. So when people can't move appropriately anymore. So there are many neurological disorders, for example, that are characterized by an inability to move, or by an inability to move the way people would want to move. In other words, to turn your thoughts into the right actions. And these are very common. So we hope to get a better handle on what is going wrong in these patients, and why can't the brain translate thoughts into actions anymore. We've been the first in the UK to combine a technique called neurostimulation. This big machine you see there is what we call a neurostimulation machine. So basically that allows us to electrically stimulate the brain of people, and to thereby study the function of specific brain regions. Now, we've been the first, as I said, to combine this with neuroimaging, so another technique that measures brain activity. Many people probably have been in an MRI scanner at some point in their life. And so we've combined these because we wanted to use neurostimulation and neuroimaging at the same time to get a more comprehensive picture of what the brain, so to speak, is doing when we move. And more recently we have introduced what we call computational neurostimulation, which basically means we build little brains or little neural networks on a computer, and then we simulate the effects of neurostimulation. So these are more methodological aspects, but one concrete example is that we've, in a series of studies, have shown how the brain deals with uncertainty. So uncertainty basically is information that we can't be fully sure of, and we deal with that every day in a lot of situations. And the brain continuously is basically making estimates about what is happening in the world and how likely is it that certain events occur. But of course, these need to be turned into actions, and we've shown that there are specific brain regions that like to deal with uncertainty, that form estimates about the outside world. But these brain regions continuously and all the time talk to brain regions that control our muscles, and give them an update about the current situation in the world, and help them to adapt very rapidly in case a new event is occurring, and an unexpected car coming around the corner or something like that. So we've studied this in a series of studies, and this helped us to understand how these brain regions communicate, to turn information from the outside world into actions, and basically showing that this happens in a very continuous fashion, which kind of refutes a lot of models about the brain, which really think of it like as a serial model, whereby information comes in and then it gets processed and then it goes to the next stage, and so on and so forth. So things are much more integrated, and in the specific case we've shown that for uncertain information and how it gets turned into